Welcome to Chiropad TV. This is Dr. Paul Bindell, President of Life Systems Software. It is with great pleasure that we provide you with this segment of our video training series for the ChiroSuite programs. In this presentation, we are going to focus on the patient's insurance policy screen. The first thing that's required is to open the patient's account. Once the patient's file is open, click on the icon for Insurance Policies. In order to enter information here, the very first step is to enter an insurance carrier. In order to enter an insurance carrier, click on the green starburst in the upper left corner, which allows you to add a new carrier. It opens up to the Browse Carrier Catalog. You will be able to locate the patient's insurance carrier in any of several ways. In the Find box, you could simply type in the name of the company. And as you type it in, and then hit the Enter key, it will bring up all the companies that you have in the system that have their name. A second means would be if you wanted to narrow it down just according to the post office box number. If you put in that post office box number and then hit the Enter key, it will bring up every insurance company that has the numbers 1211 in that sequence. So for example, the First Aetna has post office box 1211. In MetLife, the zip code has 1211. And for United Healthcare, the zip code again has 1211. In addition, if you wanted to find only those insurance carriers that start with the letter B, you'd be able to click on the B's. Or if it was G, click on G. If you wanted a list of all the insurance carriers in alphabetical sequence, click on the All button. Once you have found the carrier that is right for this particular patient, just double-click on the carrier, and that will automatically fill in the carrier's information on the patient's billing screen. There is quite a bit of information that you must enter now in order to make sure that this is accurate for this specific patient. IntelliSense is something that is of a more advanced nature, and we will get into that in another specific training program. In the box for active, it must say yes. If you have selected no, then it means that this insurance company is shut off for this patient. So if you want the patient to be able to have bills sent to this carrier, always make sure it says yes. The copay that is shown here is going to be based upon the patient's insurance card. You can set the copay amount to either a percentage or a specific dollar amount, and then simply just click into the field and enter whatever is the appropriate copayment amount. In the box for deductible, you can enter whatever is the patient's deductible under this particular policy. By entering the amount here, it does nothing as far as changing balances or transferring amounts from insurance to patient responsibility. The default in the system for the date on which the deductible renews is January 1st. However, if this program has a different fiscal year, you can change it simply by clicking into this box. Where it talks about remaining, this is the amount of the deductible that is remaining to be met. If you put a dollar amount into this specific box, then until that dollar amount is met, the system will automatically transfer the charges into the patient responsibility because it is going towards the deductible. Our recommendation is that you use this only on those patients where you are 100% sure that the deductible is going to be met only in your own office. If the deductible is going to be met by the patient going to many doctors in many different offices, leave this set at 0 and then make the adjustment when the payment comes in and you're posting insurance. The next two check boxes for accepting patient assignment and government assignment. If you accept assignment in your office, both of these boxes should be checked. If either one is not checked, the insurance companies will then use that as an excuse to pay the patient instead of sending payment to your office. On the other side of the coin, if you do not accept assignment, then uncheck both of these boxes, and you will then note that in the box for mail claims to, you can now have it mailed directly to the patient, to the insurance carrier, or in the event that this is a non-custodial parent of a child from a divorce, you can set it to mail it to the subscriber. To the right of that, you will have a box that says signature. Box 12 is the box on the HCFA form that this refers to. You should leave this set as on file, and what will happen is that when you print out your HCFA forms, box 12 will say patient's signature on file. That must also be dated, so in the release box, simply click into that space. If you want to put in today's date, push the C key on your keyboard for current date. By pushing the C key, it automatically enters today's date. On the other side of the coin, if you know that the patient signed this a few days ago and you don't have the form in front of you, but you know it was last Tuesday, you can double-click into the box, bring up the calendar, select last Tuesday, and that date will automatically be filled in. Or, on the other side of the coin, you could click into the box, hit the delete key to make sure that there are no blank spaces in there, and then simply use your keyboard and type in whatever is the actual date. Under claims, where it says cycle, leave it set to carrier. For the form type, if this is going to be printed on paper, leave it set to HCFA 1500. If on the other side of the coin, this is going to be sent electronically, select Internet Disk Image so that the system will know that this patient's claims need to go electronically. Also, to the right of that, you have two check boxes. You should make sure that ChiroPad Notes is not checked. The reason is a simple one. Electronic clearinghouses are not equipped to handle patient notes coming in with HCFA forms. So in order to avoid confusion and make sure that you get paid, do not try to send your ChiroPad Notes together with an Internet Disk Image. If the patient has more than one insurance carrier, then in After Payment Resubmit To, the other insurance carriers for the patient will be listed in the drop-down box, and you'd be able to make that selection. In the transfer and write-off amounts, what this will do is transfer to the patient anything that the insurance company rejects. In the write-off column, this would write off or eliminate from the patient's account any fees that the insurance company rejects. You can set these numbers to be anything that you want. They are percentages, and the two boxes combined must add up to 100. For example, you know that the patient has a $15 copayment. The insurance company may pay only $75 out of a $150 bill, which means that you have collected $90. What do you do with the remaining $60? Do you transfer that entire $60 into the patient's responsibility? Or do you write off the entire $60, in effect giving the patient a gift of $60? Or do you split it in some manner so that you write off 45% of it and the patient is responsible to pay you 55%? Whatever you want to do, it is your choice, and it is between you and your patient. In the claim number, this is where you would enter the patient's ID number, and this will typically print out at the top of the HCFA form, in addition to printing it in the appropriate box on the HCFA form. If for this particular patient's account there is a specific adjuster, you would then be able to enter who that adjuster is by name, phone, and fax number. The visitometer that is here is an item that will help you greatly. When you click on New Counter, by default, it automatically sets today's date. However, if this should have been entered a week ago, you would be able to click onto this pencil, and then edit the date accordingly. Based upon your talking with the insurance company, you're going to know that this insurance carrier's benefits will expire on a specific date in the future, so you could enter that particular date, or it will expire after a certain number of allowed visits, such as an approval for 12 visits, or it will expire once you reach a certain dollar amount of services provided to the patient. You can enter any 1, 2, or 3 of these items, and then whichever one is reached first, the system will give you a pop-up message telling you that the patient's insurance has expired. Once you have entered the information, it is critical that you save it so that the system will work and do its job. Under the tab for carrier verification information, when you or a staff member calls the insurance company, you would then be able to enter the date on which the phone call was made, who was spoken to, and what you were told as far as approval or denial for services. If there are other notes, you can enter those as well. If you find that you have entered information incorrectly, you can simply click on the delete key and remove the visitometer. Once you have completed the information on this initial page, click on the save icon to update all the changes. The next tab that you would click on is the subscriber tab. Under the subscriber tab, you would identify the relationship to the insured. If it is self, that is the default, and you don't need to do anything. If it is not self, then click on the drop-down arrow and choose whichever is the appropriate item. Once you have made that selection, then you would enter the last, first, and middle name of the insured person. If you do not know the date of birth, you would click into the date of birth area and then just touch the space bar, and that will put all zeros into this information. The system recognizes that a date of birth must be entered here, and if you fill in all zeros manually, then it will print all zeros on the HCFA form. Whereas if you hit the space bar, the system believes that you have made an entry, although it knows not to type that information in. You should also enter the insured's sex, whether male or female. The employment indicator is not necessary most of the time. If the patient's information is identical to the insured's information for the rest of this area, then simply put a check in the box to use patient information for the remainder, and the address, city, state, zip, and phone number will be pulled out of the patient's file. If, for example, this was a non-custodial parent, you would then uncheck this box and type in that non-custodial parent's address. On the right-hand side, the box where it talks about an insured card is information that you would get from the patient's insurance card. This is not critical information, and if you leave this blank as far as an effective and termination date, there will be no problems from the insurance carrier. The next 4 boxes under policy must have something entered. The first one, you must enter the patient's ID number for the insurance policy. For Medicare, that's all you need to do for this box. For the other 3 boxes, you must also put something in there, even if it is an NA, meaning not applicable. If you have a policy number, then fill it in to this box. If you have an employer's name or a school name, fill that in. And if you have a plan name, fill it in. However, if you have none of those, then note what you can do. Put in a capital N/A, and it will print NA on the HCFA form. However, for example, with Medicare, Medicare requires that those fields be left completely blank. So we have set up the system that when you put in a lowercase n/a, it will show here, the system will recognize that you made the entry, but on the HCFA form, it will be blank. If the patient has another health benefit plan, then this information will go in here. The next tab is for HCFA information. Click on that tab, and over here you would enter the date of onset and the date consulted. Note that in the date of onset, if this is going to go on paper, you could have the word gradual filled in simply by typing in all ones. And that way, on paper, it will print the word gradual. However, If this claim is going to go electronically through the clearinghouse, you must not use all ones in this box. You must have a real date. The reason for that is that the clearinghouses are not equipped to handle the word gradual, and if you put in the word gradual, they in turn will reject your claim. So get in the habit of using real date all the time. For the date consulted, if it is the current date, push the C key on your keyboard and it will fill in the current date. Or if it is from a date in the past, double click on the date in the consulted box and then select that date for when everything started. If the patient is suffering with disability as a result of their problems, fill in the disability information. If the condition is related to employment, car accident, or another accident, fill in whatever is appropriate. If you deal with hospitals and you admitted the patient to the hospital and discharged the patient to the hospital, then fill in that information. If you did not do the admitting and discharging, leave this box blank. For Medicare, depending upon the region of Medicare that you are in, you may or may not need to have the subluxation listing, the nature of illness, and the date of last x-ray showing up in box 19 of the HCFA form. If you need to be filling in that information, fill it in here and it will print automatically on the HCFA form. If you are doing things with Medicaid, Medicaid requires various codes in boxes 22 and 23, so be sure that you fill in that information in this space. If you are involved in any managed care program, then you would need to fill in the referring physician information. This is information that you would gather together and put in the referring physician's catalog. In order to access the catalog from here, you would click on the Add button, and then once in the referring physician's catalog, choose whomever that referring physician is, and that information will be filled in. As a side note, if you are involved in the Medicare demonstration project for the therapy claims that you would be sending into Medicare, you must put yourself in as the referring physician. If you do not, you will not get paid. Once this information is filled in, we can move to the Other tab. The Other tab refers to certain very specific information. This is for the New York State C4 workers' compensation claim. So if you are not in New York, you do not need to fill in any of this information. On this side, if you see CHAMPUS patients, in other words, retired military personnel, then you would fill in the information that goes here. The last tab on this screen is specific to the New York State C4 workers' compensation claim, and if you are in New York, then you will fill in all the information that goes here, and when you fill it in, you will click on the green starburst. That automatically fills in today's date. You would note the interval, the healthcare provider type, whether or not the services were provided under a managed care program, what is the case number, the carrier number, the date of injury, and all the other information that is standard for the New York State C4. When you are completed with all the information, be sure that you click on the Save icon and save all the information. There is actually one more area that I would like to point out, and that is the retroactive button. We've all had the experience where a patient comes in and insists that they do not have insurance. We take care of them, and then 2 or 3 or 4 months goes by, and the patient walks in and says, "Guess what? I really do have insurance. I want you to go back and bill all the services that I've had." So what you can do is come to this screen, enter the insurance company's information, click on Retroactive. That will bring up this little screen about late billing too. And if it's for all the services, you would simply click on Select All. Or if it's for just one, you'd be able to select that one. Or by using the Control key, you would be able to select only those visits that this applies to. But for now, for my example, we'll leave it set to Select All. And then when we click on Change, the system has just reassigned all of those charges from patient responsibility to insurance responsibility, and the next time that you produce insurance claims, all of those visits will be submitted to the insurance carrier. Thank you for watching this training video. Should you have additional questions that were not answered here, please contact support@chiropad.com or call us at 973-625-3716. We will do everything we can to make sure that you get the maximum benefit from using the ChiroSuite programs.